Normally, we get somewhere around 500 to 600 applications. This year, we had 860 applications.
While nurses and healthcare workers continue to deal with the emotional and physical demands of working during the COVID-19 pandemic, nursing and healthcare programs across the Lower Mainland continue to see high demand.
So we've had a 31% increase in the number of applicants for our undergraduate program. And we've had a 54% increase in the number of applicants for our nurse practitioner program.
Generally speaking, we have 3 applicants for every seat that we have. And that hasn't moved. It hasn't changed.
Part of the reason is that the pandemic has highlighted the extent of what healthcare professionals actually do.
The visibility of nurses and other health professionals during the pandemic has given people an opportunity to see this is nursing, and it doesn't necessarily fit the stereotypes of what you see on TV.
Another reason for the increased amount of applications is the changing economy and the desire for job security.
Potentially the economic downturn because of the pandemic, with so many businesses needing to be put on hold or people becoming unemployed as a result. Looking at different professions, nurses were employed, and we recognize that we always need healthcare professionals. So I think that's also spurring people's interest in terms of job security and the importance of a profession that's meaningful.
While it's good to see a growing interest in healthcare professions, the BC Nurses Union explains there's not enough nursing program seats to keep up with the demand.
Currently, we are not providing educational opportunities for enough nurses in BC to replace the numbers of nurses that we know will leave the profession.
The BC Nurses Union would like to see a better plan to retain current staff and recruit enough new nurses to fill vacancies.
I think it's important for the government to be concerned about the mental health of nurses and how we will support those who stay in the healthcare system. They do need to look at ways to incentivize nurses to stay, but most importantly, they need to look at how they recruit enough nurses to care for the patients in this province.
And the COVID-19 pandemic has highlighted just how important nurses are in public health care.
They need support from the public, they need support from the government, and that is investment in nursing education and nursing practice across this province.
In Vancouver, Miranda Fatur, City News.